Today we have a panelist, Suzanne Gordon, who is a VHPI Senior Policy Analyst, and her work expands over decades reporting on healthcare programs, workers, policy, and she has authored or edited 21 books. Suzanne has written 2 books of her own, The Battle for Veterans Healthcare and Wounds of War. And with her, she has a special guest, Jasper Craven, who is the Veteran Healthcare Policy Institute Interim Executive Director. And what we're going to be discussing is a new commission and their target for closing VA hospital. This is really a fact near and dear to most veterans' hearts about this contention about whether VA should remain open or not. So I'm so glad to have you here, Suzanne, and your guest, Jasper Craven.
Thank you for having us.
Yes. So, why don't you, Jasper, why don't you give us some more information on this? What is going on with this targeting for closing VA hospitals? There's enough going on in the media for me to have my stomach upset every day, and this is yet another dimension that you're bringing up. So tell us about this. What's going on right now?
Yeah, sure. Thanks for having us.
Sure.
So basically, this is a residual policy from the Trump administration that will soon be set up under President Biden. In 2018, Trump passed what's called the VA Mission Act, which was chiefly a policy meant to outsource and privatize veterans' health care. And contained within this law is what's known as the AIR Commission, or the Asset and Infrastructure Review Commission. And essentially what will soon happen is a 9-member panel will meet to discuss very broadly and also in specific terms the VA's infrastructure footprint today and for the future. And we at VHPI are very concerned because there is a good chance that this commission could be weaponized, especially by ideological interests and those representing private healthcare interests to close VA facilities across the country improperly in order to siphon even more care away from the VA and into the private sector, which will certainly, pad the pockets of executives at massive healthcare companies like Ascension and Blue Cross Blue Shield and others.
Yeah, it sounds like you said it started with the Trump administration, and many of the policies we know, have been sort of pulled back or sort of deleted with the new administration. Is this something that they are aware of, or how are they addressing this particular issue now?
Well, it's really unclear. In our view, the whole thing should be scrapped. And actually, I think it was 2019, Joe Manchin of West Virginia, the senator, and Mike Rounds, I guess, Montana. Was it Montana, Jasper?
I think it's South Dakota.
No, South Dakota, sorry. Please forgive me, Senator Rounds. Actually introduced a bill to repeal the whole AIR Commission, and sadly, the veteran service organizations didn't really support it, and it didn't go anywhere. And they were really concerned, correctly, that rural hospitals would be really vulnerable. And here's the thing about the way this was written. It was written to be sort of like a base closing commission where 9 people would make a list of VA facilities to be shuttered, renovated, consolidated, repurposed, et cetera, or improved. And of course, under Trump, the improved part was not what they were after, and they created this commission, and they basically insulated its actions from congressional input, because whatever lists they come up with has to be voted up or down. So if somebody in Chicago says, wait a minute, we don't want to shut this program down at the Chicago VA, they couldn't just pluck that out, and so, you either vote the thing up or you vote the thing down, and that would be very hard to do, to vote it down. Now, the president could could say no to it, and the president could send it back to the commission, and then the president and the commission could adjust the list, and the president could either say yes or no again. But again, how likely is that, even with Joe Biden? I know maybe it is, but the process is very disturbing because the 9-member commission reserves seats for veteran service organizations, 3 seats, and a seat for somebody who works in a integrated health system in a private sector health system which has more than $50 million in revenue. But when they say integrated in the private sector, they don't mean integrated, in the VA where they give integrated coordinated care. They just mean it's a collection of hospitals that are integrated basically financially.
Yes.
And then there's 1 seat for somebody who has experience in construction in the federal sector. But there's no seats that are set aside for anybody with experience in a public health care system, with population health, with veterans' health problems. So, the seats could be filled by people with special interest in privatizing the VA, and Biden may or may not be aware of that. Or, it's not, I think he's very committed to reversing Trump-era privatization and anti-government initiatives. But in this case, we're quite concerned about this.
Yeah, because I was going to ask you about the composition of the commission, and then you really gave a good overview of it. But you said something else that really I think was a key point, is that many of the VA facilities are in rural areas, and many of our our outposts, our forts, and that kind of thing are in Army bases, Air Force bases, Navy, are in areas where you don't have a very high level of health care in general for the community. And so if you remove those from those rural areas and the Fort Sills, throughout the country, you end up potentially not having some place for a veteran to go.
Oh, you just hit the proverbial nail right on the head. But the problem is that VA facilities are very, very important to not just veterans, but to their families. They're economically very important to the local community. There's a formula that's like 2 to 1. If you have a hospital that's worth $100 million, the spending that generates is 110. It's more than the hospital's worth, because the nurses and doctors go to the grocery store and they get their roofs fixed and they take their kid to the doctor or to school, et cetera, and so teachers are employed. And the issue really that is critical, there's so many critical issues with this Air Commission. One of the really critical issues, and VHPI has sent in comments to the Federal Register, is they're going to judge these facilities by, how well utilized they are. And we want to ask them to do more than just a head count, there's, 500 veterans or 100,000 veterans are served here. Well, we're expecting a decline in the veteran population, so that means, maybe there'll be, in 10 years, 80,000 veterans served in that hospital. But as you know, because you're in healthcare, if you could have 80,000 patients who have, because they're aging and they're veterans and they have complex conditions, they would still need more resources, even though there are fewer of them, which is what we've actually seen over the past several decades. Is the veteran population declines, but because of their complex service-related conditions that suddenly get recognized, and because they're aging and they get sicker, they use more resources, including more doctors and nurses and PTs and OTs and so forth. So you have to get really specific. They have to ask really specific questions, and the questions that the VA leadership put forth as the questions that were going to be asked or really were disturbingly vague.
Yes, part of my my past history, I was a former director for the Illinois Department of Public Health, and as a part of that, I was able to see other countries, the way they establish their systems, and to ask people, how did you actually come about making your system? And some of the most efficient governments right now in the world, dealing with the COVID-19 response, they actually model their system after our Department of Defense, our VA system. They actually use that, and it's one of the most efficient systems out there. So the efficiencies within the VA system, having your records, having things in place so that things can be expedited, your testing, is the most efficient system I've seen as a physician, personally. I've seen a lot of different hospital and clinical settings. So that efficiency we should not be losing. And to your point, we should be, having a place where people are familiar with veterans and their issues, and not going to a private doctor has no clue about what you're talking about.
It's terrifying what these doctors don't know about veterans. It's like, and it's just, and what's even worse is, so they just got a budget for 2021 for $18.5 billion for what they call community care, which is the euphemism they use for-profit private sector care. And that's for 2021, 1 year, the budget on private sector care equals what they spent in 3 years in total under choice. So you can see the escalation in costs, and then they've just had to, I think, add, what is it, Jasper, another 3.8 or something billion to 2022. This kind of care, this fragmented private sector care, is really expensive because everything's, an ER visit with a $4,000 workup.
Yeah, this is ridiculous, and we're supposed to be getting better, not worse, right? So Jasper, what can we do? To really push this issue, because it's an issue that hits the heart of every veteran and their families, their family members that seek care. What should we be doing to voice our concerns or to get involved in this process?
Yeah, I would urge listeners to call their local representatives, their senators, and, make sure that they're paying attention to this commission and that they're aware of the vital services that their local VA provides. Unfortunately, politics has really overwhelmed policy when it comes to the VA in recent years. As Suzanne and you have just pointed out, this is an efficient system. It's also the cheapest way to care for veterans. This is a smart expenditure of taxpayer dollars, and so people can weaponize arguments and say that by closing down a VA facility there will be some sort of cost savings, but that is so short-sighted. In the long run, this is just going to cost more money. It's going to result in poorer health outcomes for those who served. So, I think that very few lawmakers really have this on their radar, and yet it's an impending threat, and people need to, speak up about it.
Oh, so their constituents, the people that are voting for them, will actually have to pay more in taxes potentially. It seems like that's something that would be want to pay attention to. If I'm voting for someone, I want someone who's going to be rational and is approaching this in the right way, so that we spend our tax dollars on things that really are meaningful as we rebuild the nation. And this doesn't seem like it's a logical step. It seems like it's counterproductive right now.
Yeah, absolutely. Joe Biden's main campaign pledge was to build back better, and that needs to also apply to the Department of Veterans Affairs, and that's what we at VHPI are really fighting for.
That is fantastic. Is there something else that, is there a place that someone can call or find out more information on this to be, educate themselves on?
If you go to our website, which is veteranspolicy.org, we have a whole bunch of papers about the issue of this kind of air commission and so forth, and Monday we're putting up another paper that I wrote, which is an analysis of a new article that came out in the Journal of the American Medical Association Network, where these two privatizer doctors are recommending kind of reducing the VA footprint from delivering comprehensive care to just primary care, mental health, and maybe rehab and some other sort of services, and then people would be sent to the private sector, for urology or whatever, and this would dangerously fragment veteran care and also increase costs. So, if you go to VHPI and you look under the blog or you look under our work, you'll find a lot of stuff. And we are also having a Zoom meeting, which Jasper, will it be advertised on our website? It's going to be on the 29th of April at I guess it'll be noon. No, wait, it'll be 1 o'clock Central.
2 p.m. Central.
2 p.m. Central. Okay,
yeah.
2 p.m. Central.
Okay. I would advise folks visit veteranspolicy.org and sign up for the newsletter to be on the email list. We don't, spam people at all. We don't sell information, but you'll get, periodic updates about what we're doing. You'll get information about the Zoom forum, and, be able to keep track of these issues.
Yeah, because our Zoom forum will have some really great healthcare experts who are experts in the impact of hospital closings, of the failure of the broader healthcare system to provide primary care and deal with people's social needs. It's going to be really a great forum. We're very excited about it.
Okay, we have about 2 more minutes to go. Maybe in the last 2 minutes, if you can tell us, really why people really should be concerned about this. And if there are legislators listening, I know that some that do listen to the show. And we also have firefighters who are veterans, and we also have police officers who are veterans as well, who I know listen to the show. I've been finding out about more and more of that this week. But this goes, nationally, internationally. And what is the message that you want to send about why our veterans count and why we should be taking care of them in a proper way with the VA system?
Yeah, I would just say that for so long in American history, there has been this unfortunate trend where, a war happens and those coming back from that conflict are not properly cared for. Lawmakers never fully budget out the long-term consequences of this fighting. And I think it may be enticing now, as President Biden has just announced the end, hopefully, of conflict in Afghanistan, to think that sort of these issues are wrapping up. And, frankly, the Air Commission is betting on the fact that there will not be another conflict, perhaps ever, or at least in the near term. But I just, I find myself, as I study these issues, so frustrated by the fact that these issues, these mistakes are repeated over and over, these assumptions that, that the struggles of veterans, that their health care needs are short-term issues is just so wrong. And what needs to happen is the budgeting needs to be appropriate. It needs to be strong so that veterans are able to get care easily, so that they don't suffer mental health issues. They're not frozen out of this system. Yeah. Healthcare is such a strong indicator of quality of life, and so people really support healthcare in the right way.
Well, thank you very, very much, our partner, Veteran Health Care Policy Institute, VHPI. And again, go to veteranspolicy.org. And the 29th of April, 2 p.m. Central Standard Time, they're going to have a Zoom meeting that sounds like it's really important for us to be a part of. And then also, we need to thank Suzanne Gordon for her partnership with us. And Jasper Craven, thank you again for your insight and what you've been saying.
Thank you, Jim. Thank you so much. Take care.
Okay. Thank you.
Bye.